Hello, my name's Alex McMahon. I'm the Chief Nursing Officer in Scotland. This is the second year that I've been asked to say a few words. Last year, however, I was in the process of coming into this role on an interim basis, but I was fortunate to be appointed substantively on the 1st of January of this year. So I'm both delighted and feel great privilege in being the Chief Nursing Officer in Scotland. But I wanted to congratulate all of you in undertaking the programme that you have done and in graduating from that programme. You are amongst the many nurse leaders for the future. It's a challenging, but at the same time, very rewarding, I think, future. How you will shape that, I think, will be hugely important. And I guess it falls to me and other Chief Nursing Officers across the UK to try and create some of the conditions that you and your colleagues will work within and to move that agenda forward on our behalf and indeed with us and others. Certainly within the Scottish context, there is much that we are trying to do in relation to providing longer term sustainable health and social care services. It's probably fair to say that there are workforce challenges, not just in social care, but equally within health as well. From my perspective, we are looking at that through a lens of not just nursing and midwifery, but also through allied healthcare professionals and health scientists as well. We recognise that there is much to do in terms of how we train our students within our undergraduate programmes, and we are looking at how we set our student nurse and midwife intake numbers, and indeed whether or not we should have more than one intake per year. At the same time, within the allied healthcare professionals agenda, we are looking at how we might increase access routes into some of those professions, and whether or not we should actually set numbers in terms of intake numbers for some of those disciplines as well. And we are about to embark on a piece of work around the role that our health scientists play, and there are over 50 of those professionals within our system, and what can they do to support the services going forward. But in relation to nursing more specifically, I think the opportunity to look at access programmes, to look at apprenticeship programmes, to look at the way in which people can move through the grades, particularly bands 2 to 4, and then from 4 into 5 and 5 upwards are really important. Creating the conditions that would support people to progress will be hugely important, but also to be able to provide those educational packages of support as well. So that's why we are doing a lot of work in Scotland, particularly around band 4, but equally, as I've said, looking at how we set the student nurse intake numbers and whether or not we should have more than one intake per year as well. Equally, at the other end, we are looking at the transforming roles agenda and how we continue to look to see where we can develop new roles that nurses and others can undertake, and that they undertake them meaningfully in terms of the contribution that they would wish to make. Whilst at the same time looking at the research agenda and how we work with the academic sector to ensure that we are commissioning the service research that we need, that we're creating opportunities for nurses and others to undertake research, and that research in itself is not seen as an add-on or something that by exception we would expect nurses to undertake. But how do we create the conditions in terms of equity and parity like we have within medicine for nursing research to be more fully supported? And that's something that I'm committed to doing during the course of certainly this year and indeed into next year as well. Because that research and that research community should help to influence how we in government, certainly in Scotland, inform policy and give advice to ministers. So although I think this winter and indeed going into next year will provide its challenges, equally I'm sure there are many opportunities, and we need to work collectively to ensure that we do everything we can to provide the safest possible care to patients and indeed to our staff too. And that's why this year we're progressing the implementation of our Safe and Effective Staffing Bill that was passed in 2019 but paused because of the pandemic. And that framework will provide us a way into ensuring that across every territorial board in Scotland we're providing a level of consistency and that we can measure pressure ulcers and falls and staff absences, for example, on a like-for-like basis. So there are many positives, I think, that we need to look forward to. And I hope that you, with your qualification and your renewed vigour and interest in all things leadership, will work with us, not just in the Scottish context, but the UK context, to drive forward the agenda and the improvements and the sustainability that we need going forward. Best wishes, and I hope you have a good day.